Hi everyone, Marina Kukla here to talk about cognitive behavioral therapy for work success, CBTw session 12, the personal work success plan. So this is our 12th and final session of CBTw, and like all the others, you'll start with your introductory elements. The work check-in, everyone will go around and sort of give their final updates on where they are with work. Then you'll have your homework review from session 11. Our take home was to consider strategies to improve motivation to work or continue working, and trying out those strategies and writing down the results. It may be that people didn't really do this, but if that's the case, you can kind of have an open, brief discussion about what strategies they have tried or what they do and don't struggle with motivation, and you can still kind of go over this a little bit. Then you'll do your agenda for session 12, which are these 3 bullet points: making a personal work plan for success at work, thinking about the group, and basically providing feedback on how it was, and then sort of group conclusion and wrap up. So we start by just talking more about what work success means for us, and specifically this idea that work success is something we have to manage. It's not just something that happens and then we can just passively consider that and go through that. It's something that it can be scary, it can be anxiety provoking, it can be stressful for all of us. Just like when we got our first job where we were in charge of stuff, we were no longer under someone else's direct supervision, or we maybe were supervising other people. And so that can be scary to think of, like, now I got to be the one to do all of these things. So some people we work with fall into the pattern of sort of being self-destructive or self-sabotaging when it comes to success, or just other things. Like, we've all worked with people that they get that success or they get that job or even that interview, or they start and then they go to work having been drinking alcohol or using drugs, or they don't show up to the interview, or that one day they just stop showing up to work and they lose that opportunity. And part of that is this difficulty managing success and what it really means for us. And so all of this sort of is discussed on page 112, and it's helpful to read through this as a group and have somebody read out loud. I think also this emphasizes this idea that for so long, folks may have viewed themselves as too sick or injured to work, and now they're actually going out into the world and in a new way, and they're relating to other people, and they're actually going out and doing this, and it's a big deal. So we have to kind of pay attention to that. So now we introduce the work success plan and the steps of the plan, which are loosely based on the 4 A's, although expand much beyond that. Our steps are to lay out the current work situation, to be aware about our thoughts about work, assess our thoughts, and answer the ones that are unhealthy, unhelpful, and inaccurate. But I think the key is answering those thoughts that are tripping us up and causing us the most issues. And then acting in a way to support that. And so ACT is really broad here. It could be anything in the world that veterans might find helpful, and also that's reasonably healthy. Like, you wouldn't say like using drugs to address your anxiety would be something that you would put under ACT, of course, because that's not healthy or helpful. And then accepting that we are capable of managing success, and also maybe that we deserve success. And there's people who don't really feel that way. And I think especially for people who haven't worked in a long time, all of this can be difficult. So, and then we add some other steps. Number 7, give yourself time and be patient. It takes time to manage success, and it's a process. We don't just do it one day and it's over. And then revisiting your plan and tracking your progress, what's working, what's not, what do you need to change, what issues do you need to take a look at and try to manage. So then we have our specific steps here where we go into great detail, laying out the plan, what's happened, what's the scenario. For example, did you just get a new job? Do you have an interview coming up? Are you the boss now? Did you get a promotion or a raise at your job? Are you starting in a new field of work, or maybe you're going back to work after having not worked in a decade? Being aware of your thoughts. And so you can ask yourself, what am I happy about? What am I scared about? What am I concerned of? What's stressing me out? What's the best case scenario outcome? What's the worst case scenario outcome? Paying close attention to those negative and unhelpful thoughts about the success. We also talked last week about, for those who were in session 11, how they would define work success for themselves, which for every person is going to be a little bit different and multifaceted even. Success for each of us probably involves different things and at different times based on our priorities and what we've got going on. And so a lot of this relates back to that as well. Assessing those thoughts in our usual assessment and then answering them. So here are some examples here. For example, if you got a new job and your thought is, I haven't worked in 10 years, I'll never be able to do this. My PTSD symptoms always seem to get in the way. This is obviously not helpful or healthy if your goal is to go into that job and have some success and stay there and try to do your best at it. So a changed thought or an answer thought might be, I haven't worked in a while, but I was great at my job before. I'm smart and I know what I'm doing. I'm a quick learner. Like, I can do this. That would be a great answer thought or a set of answer thoughts. Then we have our act, and we remind them of a bunch of act strategies. This is really broad, and it's okay if they don't use any of these and they use their own that might not fit here or might not be here. We really want it to be very personal and unique to each individual veteran in that group. So in other words, each plan and the step of each plan is going to look different for each person, and even different for people who maybe had similar sets of circumstances or patterns. They may look a little bit different. So we remind people remembering to manage difficult emotions, of course, dealing effectively with people. We have entire sessions on that. Advocating for yourself, for example, asking for a reasonable accommodation, remembering that work journal or some outlet to actually write down those thoughts, those experiences, maybe how you're feeling, what you're going through, and maybe just to track your goals and things like that. Do something fun, use those pleasant activities outside of work, taking care of your mental and physical health, remembering your medications and your self-management skills and the other things you need to do to take care of yourself, getting adequate sleep, eating well and exercising, keeping a calendar. I mean, this is a small thing, but a lot of people don't do this and it can trip them up. And it helps time management inside and of course, outside of work. Dressing for success. And so paying attention to how we're presenting ourselves to the world and also to ourselves. Minimizing distractions and ways to procrastinate. That was in our active listening session and communicating at work session. And then updating your resume periodically, even while working. Focusing on maintaining your motivation to work. For some people, that might be the key issue. And for other people, motivation might not be something they struggle with a lot, or they may already be managing it pretty well. So for each person, the arc of this is going to look different. And there might be 1,000 other things they're going to focus on as well, specific to them. Some people already have a pretty solid plan for taking care of themselves and paying attention to what they need to pay attention to. And CBTw, of course, we're going to more heavily focus on those cognitive or those thoughts that are tripping us up, those patterns that we've done over and over again, especially in our lives that have tripped us up in past jobs, what's gotten in the way. Maybe they have trouble working with other people or dealing with a boss that's giving them instructions. Maybe they find people confusing. And so all of these things would be different pieces of a plan. And then lastly, accepting that you're a person capable of handling success, deserving of success and all of that, giving yourself time. It takes a long time to do this well, and we're going to have a mixed track record. Sometimes it'll go well, and sometimes it maybe goes poorly trying to manage this. So your first day of work, you're not going to know everything or know how to do everything or all of that stuff. And we have to work towards a place where we can be okay managing that discomfort. And then lastly, like revisiting that. I would say that, one thing that you can do as facilitators to really further facilitate this is get as many details and as many narratives from veterans as you can. If they say something that's vague, get that detail from them about that. Ask questions, ask clarifying questions, make it really explicit. And the purpose of making it explicit is for them. Use reflections when appropriate. And even if it sounds repetitive, use those thinking words, use those behavior words, like especially as they identify, okay, these are the thoughts that get my way. Here's the stuff I keep doing, these actions that keep getting in my way. I drink, then I lose my job, or I stop going to work. And so reflect that back. even if it sounds like a little bit repetitive to you, it's helpful for them. Also reflect back these strategies or these factors they find important. I think that there may be times for sure when people don't bring up factors that you think for them might be important. And I think when they're kind of done, you might gently insert your own ideas, but I wouldn't argue with them or tell them that they're wrong or even judge them. The idea is maybe here's just some other things. And if they're like, no, that's not for me, then that's okay. What's important is that this makes sense for them. I think especially if they've shared those things in group, like people have shared, I have trouble with other people at work, or I feel like people are often talking down to me, so it can be hard for me to like understand what they're saying or what they mean. And that could be something that you could reflect back. If they haven't brought it up here, you think it's important, you can say, well, you shared with the group in the past that sometimes you have trouble dealing with people. Is there anything that you'd want to put on this about that? And maybe they say yes, and maybe they say no. I wouldn't force it on them if they don't feel like it's something they want to put here. That's okay. That's totally fine if they don't. This is really for them. And we don't want to say their plan is wrong or something like that. So, and then you want to give people plenty of time to work on this, and maybe 15 minutes, 20 minutes. This is basically the entire session. But then what's most important, I think, is that they have time to share with the group. For people who don't have their manuals, please encourage them to find a piece of paper to write on. If they still can't do that, if they're calling in from somewhere and they just don't have that available, or they're not willing to do it and they say, I don't want to write, still have them share. Very specifically ask them about what factors would go on their plan. Try to pull those details out of them as much as you can, even if they're vague or they're like, I don't know, or they identify one barrier. Get the details around that. How would they address it? What other things have they thought about from this group, or even in their lives, not from this group, that seems to make sense that they need to do to be successful? Maybe it's not cognitive and behaviorally oriented at all. Maybe it has nothing to do with this group. Get those details even from people who are like not writing this down. So please give everyone a chance to share as much as you can. You should have time, depending on how many people are present in the group. You should absolutely have time though for everyone to go around and share something. They may not be able to share their full plan, but if you have 2 or 3 or 4 people, they might be able to share their full plan. And then lastly, once you've gone through this, then the take home, there isn't one, but it's just to say, paying attention to your work success. When do you experience it in small ways? When do you experience it in bigger ways? Successes can be simple or minor. Maybe you made it to work on time. Maybe you went 2 weeks without taking a day off that was not previously scheduled. Maybe you're getting your work tasks done more efficiently, or you find that you're working more effectively with other people around you, or you're communicating better. It could be a million little successes that we oftentimes don't give ourselves credit for. And that's the idea here. We're also asking people to use the strategies that they just put in their plan, and pay attention to those factors that they said, you know what, I'm a person who gets low motivation. That can really be a problem for me. I need to pay attention to that to keep it where it needs to be, and figure out what to do when it's not high. So that's sort of the take home. And then we have our conclusion, which thanks them for participating in this. And we hope this has benefited them. If there's time, this is a good place to seek feedback. Just ask what people thought of the group, what was helpful, what wasn't helpful, overall, what was it like going through it? Of course, as the study team, we appreciate any and all feedback, good, bad, or otherwise, about this. And just thinking about what people individually took away the most. And as you've found, or as we've found too, people take away different parts of this that they find helpful and that hopefully they'll use or keep in mind as they move forward. So thanks again for acting as facilitators, and I hope the final session goes well.